Hi, my name is Sarah Shaw. My pronouns are she, her, and I'm the Senior Manager of Black, Indigenous, and People of Color Community Outreach at the Global Healthy Living Foundation. Tonight's Melanin Health Table Talks is about representation in healthcare settings, a conversation with melanated healthcare, and we're joined by two special guests, Dr. Lecresha Sewell and Dr. Whitney Graves. I'm going to just tell you a little bit about both of them. Lecresha Sewell is the Chief Executive Officer and founder of Melanated Healthcare. She is a board-certified women's health nurse practitioner in Louisville, Kentucky. Dr. Sewell earned a Bachelor of Science in Nursing from the University of Louisville in 2010. Then she obtained a Master of Science in Nursing with a concentration in women's health in 2013 from the University of Cincinnati. She also received a credential as a sexual assault nurse examiner in 2013. In 2017, she earned a Doctor of Nursing Practice from Chatham University. She has worked in various healthcare settings, including primary care, forensic nursing, prevention and wellness, nursing education, aesthetics, family planning, neonatal nursing, and women's health. She is passionate about health equity and seeks to eliminate disparities. Dr. Sewell is involved in many community organizations and serves on several committees to promote health equity. We're also joined tonight by Dr. Whitney Graves. She is the Chief of Operations for Melanated Healthcare and is a practicing family nurse practitioner. She obtained her Bachelor of Science in Nursing from the University of Louisville in 2011 and her Master of Science in Nursing with a concentration in family health and Doctorate of Nursing Practice from Frontier Nursing University. She is dedicated to serving the community and patient focus with proven strengths in holistic patient care and patient advocacy. Dr. Graves displays an exceptional aptitude to deliver positive patient outcomes in a fast-paced environment while simultaneously building productive relationships. She has a variety of experiences ranging from primary care to sexual health to home health. So let me just welcome both of you. Welcome Lecresha and Whitney to our Melanin Health Table Talk. I'm so glad to have you guys here tonight.
Super excited to be here tonight. Thank you, Sarah, for introducing us and giving us this platform to have this conversation.
Absolutely, no problem. And to all of y'all in the attendees joining, welcome you tonight. So feel free to hop into the chat box, say hello, let us know where you're joining us from. I know right now we have, a couple of states chiming in, New Jersey and Kentucky. So let's see where everyone else is chiming in. And while y'all are doing that, why are we here tonight, right? I guess let me give some background. In addition to working for a GHLF, I also happen to be a patient myself. I live with chronic migraine, anxiety, and endometriosis, and I see a few doctors every year to not only manage my chronic illnesses, but also my health in general. And for me, as a Black woman, I seek out care for women doctors of color. If I can help and make sure that those are the doctors that I'm able to see. And I know and recognize that sometimes that's not the case for everyone. Sometimes that's not what they're able to access or get access to. And I have a poll question for everyone to answer tonight. So let me just launch the poll. I'll give you all a minute to answer that question. So I want to know from you all in the audience, do you prefer to see a doctor of color or a doctor of the same race or ethnicity as you? Is this something that you're able to see in the area that you're with? Are you able to see a doctor or is this not something that you're able to get access to, or do you not have a preference? So I'll riff here for a little bit while we're waiting for people to fill out the poll question. So are you able to see a doctor? I would prefer to see a doctor, or do you currently see a doctor right now that is a doctor of color or a doctor of the same race or ethnicity as you? So while that's going, I guess let me talk a little bit about how we came to be here tonight. So when I was doing my own search online, when I was looking to find a new primary care doctor for myself, I have my headache specialist all lined up. I have my OBGYN all set up, and they're all women of color doctors. And I was like, you know what? It's time for me to, look for a primary care doctor. And I was doing a Google search to see if there was something out there that allowed me to search specifically for doctors of color. And that's actually what led me to Melanated Healthcare. Was all of a sudden your app popped up on my Google search. And I was like, oh my gosh, this is amazing. Something like this exists that connects patients with BIPOC patients with doctors of color. And that's sort of why we're here tonight. So I am going to end the poll, and I'm going to share the results So it looks like I see a doctor of color for my appointments is the most. 60% of you said that is what you're able to do. 40% of you see a doctor of the same race or ethnicity as me. And then 20%, I would prefer to see a doctor of the same race or ethnicity, but there's probably barriers such as insurance, or maybe there's not people in close vicinity to the area that you live that they're able to get access to that. So thank you all for filling out the poll. Now let's get to our two special guests. So what brings us here today is this search that happened, and I want to dig into, who is or what is melanated healthcare. So Lecresha and Whitney, why don't you walk us through the history behind the creation of melanated healthcare today?
I guess I'll start. My background, as Sarah mentioned, I am a board certified women's health nurse practitioner. I've been in healthcare for nearly 2 decades and practiced in the Louisville area for 8 years. Really and truly, the backstory behind me even getting into healthcare was the seed that was planted when it came to forming melanated healthcare. When I was an undergrad, my sophomore year, I got pregnant, and I hadn't lived with my mother since I was 15, so I didn't really have the guidance that would have been helpful at the time when I was 20 to help me navigate the healthcare system. So I kind of had to figure some stuff out. She wasn't even in the state. My mother lived in a different state. And I ended up connecting with a provider that lacked cultural competence. And that experience led me to want to become a women's health nurse practitioner, to change what that landscape looks like for other people that look like me. And fast forward, I'm in practice, and I love my patients. Oh gosh, I love my patients. And when they would come to me, oftentimes they were like, "You're the first person that listened to me." I'm so glad I was able to connect with someone that understood me, that looked like me, because I might come in there with some box braids or a silk press, or or my sew-in or my unit. You never know. I mean, they feel me though. So just being able to see someone with the same shade really made a difference and provided comfort to them in a lot of ways. And sometimes I would just have them come back just because they saw somebody else and was like, I don't really trust them. I just wanted reassurance that what they were telling me was correct. So I got a lot of that. But with me being specialized, oftentimes it was a matter of, well, I need a PCP or primary care provider. Can you refer me to someone? And I would find myself scrolling through my call log, and I'm just like, I got friends, but some of the specialists were limited in my reach, in my network. So really wanting to create the ability for patients to easily, like you said, Sarah, just have a resource to find a provider of choice. This information isn't generally forward facing and the payer and employer side, just because of the issue that could be around discrimination on that side, the corporate side, if it was readily available. So for us, it was just a matter of making sure that people had the choice, the ability to choose a provider of choice. And that's where Melanated Healthcare came in as a directory. And then moving forward, we moved on to the telehealth piece to ensure access for everyone.
Okay. Hello. So I've known Lecresha since 2006. We went to college together.
And
We did. When she was pregnant, I guess I was pregnant too, helping her, raise, she used to sleep in my dorm.
And did that.
And so that's been a journey, like watching her through that whole, like she said, I always say we're babies, even though we were like in our 20s, early 20s, but we were like babies trying to raise a baby. And like she said, just the cultural competent piece to it. My background, my nursing background is in the neonatal ICU with the premature babies. And just the health disparities in that alone, that's a whole thing in itself, with maternal outcomes, with infant outcomes. And I've just seen a lot of just health disparities in that space. A lot of people, it's just a lot of not understanding. And a lot of times what happens is they feel like, especially because they don't look like you, um, like we've had plenty of conversations with doctors when I used to be a nurse about like, I don't really know how y'all came up with that, but you need to go back and explain it again. Or you need to get an interpreter and explain. It might not even be my language. I'm like, I don't think they got that. Get you an interpreter and explain it. So really it's just providing good, competent, culturally competent care to people and make sure they understand, because the more that you understand, the better decisions you can make for your health and get better health outcomes.
No, I think, sorry, Lecresha, were you going to say something?
No, I was in agreement. I was like, absolutely. Okay.
I think what both of you bring up is so important. We're going to dig into this a little bit more later in the conversation, but especially Whitney, what you brought up about healthcare disparities in for neonatal children, and we know that the statistics are out there about specifically Black women dying in childbirth or not getting the right care that they need to not only survive their pregnancy, but also like have their baby survive as well. And so I just appreciate what both you and Lecresha are doing with the app, and what it's going to achieve. And we're throwing around a lot of words: culturally competent care and healthcare disparities. So would you both mind like digging in a little bit more into what are healthcare disparities? I know what it is, but I think it's good to kind of like have a discussion about it.
Okay. For me, I feel like healthcare disparities refers to like the differences in health outcomes, access to healthcare, the quality of care. And a lot of times that's based on socioeconomic status, race, ethnicity, geographic location, gender, disability. And that's where the healthcare disparities come from. And a lot of times people don't feel like that's a big deal, but it's a huge deal. And it needs to be addressed, because if you don't address those like those social determinants of health, then what ends up happening is you get poor quality of care. People aren't living as long. There's no access. Like I was reading the other day where food deserts, for people who don't know what that is, like where people don't have access to like grocery stores. And so you're not eating healthy. And then, I mean, in the long run too, the worse that someone's health outcomes are, the more money, yes, it's poor quality of life, but it's the more money you spend too for the insurances and for the government as well.
Definitely. You summed that up really well in regards to health disparities. Culturally competent care is the knowledge and skills and ability to provide unbiased, effective care across cultures. So really, that's what sums up culturally competent care. So that's what we're shooting forward when we onboard providers. We really want to ensure that they have the knowledge and skills, capability to provide effective, unbiased care.
Absolutely. Both of those things are so important when, you think of a patient maybe who hasn't been to the doctor in their entire life, and we want to make sure that they feel safe, they feel seen, they feel heard, they feel validated, that their doctor understands, like, that there was an example that came up where a patient that I was talking with said that, well, I saw a white doctor and they told me that my diet is not healthy, but then not understanding that there were certain parts of like the diet that was part of their culture, that the certain foods are a part of their diet. And so if I had seen a doctor that either looked like me or from a similar race or ethnicity background as me, then there would have been that understanding and the different tweaks that we could make to my diet to do that. But because there wasn't that understanding, and I could bring up thousands of stories, and I'm sure that both of you have probably come across this through your schooling as well of what's taught, right? Of healthcare disparities are things that are also kind of ingrained in the medical system as well, where change needs to happen in schooling. For example, there was an article that I read a few months ago about this one book that said like Hispanic people and notes it wrote like normally like shows up late to appointments because of X, Y, and Z. And it was just like I was shocked that was something that was like being taught in medical schools about certain races and ethnicities for patients, where it's like that bias shouldn't be involved in the healthcare system. Like that's something that, no matter what family or background you come from, I think everybody deserves equal access to care and treatment. And that bias is unfortunately still pretty prevalent within the healthcare system. And I'm curious what you both have gone through and things that you've experienced during your schooling, or things that you've noticed or noticed that you've brought into melanated healthcare that are helping to address these healthcare disparities.
So the first part, you said you were curious about what we've seen in our schooling. For us, it was just really, we were all like the only brown people. You look at our our graduation photo, that's how we obviously became, well, not obviously, but I mean, you told her she was going to be my friend, and here we are almost 20 years later, still friends. Yeah, that happened in real life. But yeah, I mean, there were very few of us, and the things that we were taught was just based standard textbook on generalized data that was primarily consisted of just white people, not many of us Black and brown people. So there wasn't really the contrast. If a Black person shows up with this skin issue, then this is how you should treat, as opposed to someone with a different skin tone. So, I mean, we didn't get a lot of that. And a lot of what we learned was environmental, that we were able to apply, and culturally, again, just bringing it forward, that someone who hasn't had that lived experience may not necessarily be able to bring forth, because I mean, they really don't teach a lot of that. Well, back when we were in school, it's been a little bit, but back then, I mean, it just wasn't something that was evident or, really taught.
Yeah. I agree with that. And also too, just in practice, like I said, going from, like being a nurse and then into the nurse practitioner role. There's plenty of times I was just talking to an old coworker the other day where I never forget, there was like this 23-week baby that we had, and, it was Hispanic. Parents spoke, Spanish only. And every time they would come in, like the doctors would be like, "Oh, everything's good." And I'm like, no. Like, we coded this baby, like, so like, no. And I'm like, so you're not going to go get like the interpreter phone? Like, that's not an issue for you.
Right.
And, I had a coworker, like, we really went to bat, and I was like, you can't do that. You just can't look at them and say everything's okay, because you feel like it's annoying to go get the interpreter phone and talk back and forth. Because that's the last thing you would want, especially in like a condition, like anything. Like if I want to go in, and I feel like too, going back to healthcare disparities, it's about equality. Mm-hmm. And really it's a social justice issue. We always want to say, equality and everyone's equal, but if you're not providing that competent care and bridging those gaps of the disparities, then you're not even going back to like, all of our independence and equal, you're not providing equal opportunities for everyone. You're not treating everyone the same. It's not fair. Being a provider, I can name things for days about just different healthcare things, or even like when people come in and like you talked about, you made the comment about the food. Just even talking with people, I'm like, hey, has anyone ever talked to you about this? oh, no one ever talked to me about that. Or no, they didn't say I could switch this for that. Or, oh, no, they didn't say, or they'll put them on a med that might not be suitable for African Americans. I'm like, why are you on this medication? Why are you doing that? Well, how do you know that's not causing this? Because in studies that show that in African Americans, these types of side effects go on. And they're like, oh, my doctor never told me that. And it's just those types of things where it gets very tedious. It's like an interesting battle. I'm like, you all know this because I know this. But like you said, it's a fight. Somebody has to do it. That's why we're here. Just want to educate people. Just want to be equal. Just want everybody to live I know it sounds really cliche, their best life. Like, like Drake says, YOLO, you only, but live your best life,
So no, I appreciate you sharing. I mean, because even in the women's health space, like you said, for days, so many things in the OB world, just C-section rates out of this world. Not even going in and explaining the necessity. Just you've got a vacation type situation. So let's go ahead and speed this up. Like teaching patients how to advocate for themselves. A lot of that and took place. Like you can get an explanation. Don't just feel like because someone has a white coat on that they know all being and knowing. Like it doesn't work that way. You have a right. You have choices. So that I felt like in this role that I have done and still do a lot of that, just letting people know, because historically, I mean, again, we didn't have a voice. So it kind of carries forth. And we see it all the time in practice. I'm like, yes, you do. You have a right to understand why you're taking this medicine. You have a right to understand why it was prescribed. I don't care if they're on a timeline and they have 20 patients waiting. I would ask for more time. I don't care if, whatever the case may be, if they need to get on that interpreter phone, so be it. I mean, you're new to this country, learning how to navigate the health system. There should not be a reason why someone wouldn't want to take the time to sit and talk to you and explain these things. So I felt like this, in addition to practicing and helping people stay well and healthy to the best of our ability, we are on the front line of making sure that people realize that we're advocates for them, they're advocates for themselves, and how to go about doing that. So.
Yes. And also, this is a nationwide problem. I remember when I did travel nursing, like I've been up north. We were just talking about that before. And I've been out west. Like I've been to California. I remember in California, like they have cameras so you can like watch your baby from home. And I remember getting on the interpreter phone and telling a family, I don't even remember what language they spoke, but I remember telling them like, hey, did you all know you can have a camera? And I got them set up with that, signed up for it. And then you can hear them talking to the other people, like of their culture, like they're talking to them. I'm like, hey, do you know you all can have a camera? So now everyone's asking for one. And I'm like, we make that up. Like we always tell people like, hey, you can have this. Why did you all get skipped? So it's things like that. Like, why? No one has time for that.
No, that's so important. I think you brought up a good point about once word of mouth spreads. Like I feel like it's so like tight knit within our communities. When we have a good experience, we're like, hey, did you know about this? And did you know, like, or this doctor sat and like listened to me, or like they didn't treat me differently because I came into a doctor's appointment with my with my like Lecresha was saying, with my box braids, or with my afro, or with my cap on, something
Right.
like that, like something that I don't do this as much now, but I think I still kind of do it, of where I feel like when I go to the doctor, especially if it's like a non-POC doctor, I feel like I need to like dress up and like dress like I just came from work to be taken seriously. And I feel like that should, number one, not be the case. Like you should be able to just show up as you are to the doctor, like you're in pain or you need treatment or you need to change medications or whatever. You should be able to show up as you are. But in the beginning of my chronic migraine journey, I was like, they won't take me seriously because they hadn't before. And now I see, almost all of my doctors are women of color. And I feel like good coming in with my twists or my box braids, or, I haven't done it yet, but I haven't worn my my nightcap to the doctor's appointment. But like, so I've spoken to other Black women. They're like, I just wish I could just show up wearing my cap, like that's just one thing I wish I could do. And I think I I think all of these things, access, food deserts, something too, which is also like an issue, is just access. Like, are doctors' offices and hospitals, are they in a location that are close to a bus stop, for example? As we know, there are many people that don't have cars or don't have access to a train, maybe the bus system is the only way that they're getting to the doctor. And if you're putting the bus stop, 5 miles away from the closest doctor's office, then that's also a reason why our communities are not getting to the doctor. I'm curious about switching gears about like how are you as an organization, making sure that you're encouraging melanated doctors to sign up and also like getting the word out to patients about it?
I'll start. Often, we're seeking strategic partnerships, and kind of how we connected, Sarah, just wanting to connect with organizations that support our mission, as well as provider networks that support our mission. Getting out in the community. We do a lot of community work with, like I'm on a board for Black Nurse Practitioners of Louisville. So just a lot of different organizations that we partner with providers and systems and payers. So it's been a lot of that as far as getting the word out and encouraging them to sign up.
I was going to say a lot of word of mouth, community outreach, and everything else she just named.
That's great. I know a lot of this is like on the ground, meeting our communities like where they are, going to churches and, meeting them in barbershops, which is something that we're doing as well with a new program that we launched called the Heroes Program, which is a program that is connecting barbers and hairstylists with education about skin and scalp conditions like psoriasis, atopic dermatitis, and alopecia, because we recognize that what's happening at these barbershops, a lot of conversations, and sometimes health comes up, and the barbers are the ones that are like kind of up close and personal, looking at your skin, looking at your scalp, looking at your hair. They can be the ones to kind of maybe notice that something is different, like balding or, flakes, or scales that are happening like on your skin and scalp. And so that's one, creative way that we're able to address healthcare disparities, because a lot of what is happening is people just don't know. They just like kind of like what both you and Whitney were saying is, people like if things aren't explained to them at the doctor's office, like why are you on this medication, or people just take things and maybe don't ask questions because they don't know that they can ask questions. Like when I was a kid, I feel like too there's this added not pressure, but there's this added like thing of where when you feel like you're at the doctor, you feel like you can't ask questions back because you feel like you have to just sit and like listen and just be scared. And like I'm now, many years into my advocacy world, and I'm like I go in, I talk to my doctor, we do shared decision making. I ask questions if I'm not sure of like why, or like I ask questions about side effects or what are the potential things that could happen, and we have a candid discussion about that. I would love to talk about these conversations that are happening, in your Whitney's and Lecresha. What conversations are kind of happening in your offices to kind of make the patient feel like they can, I guess, have a conversation with you?
So I do home health for the elderly population, and a lot of the conversations that I have with them is just like, hey, let's go over your meds. Like, it's really relating to people and meeting people where they're at. You don't even have to be a Black woman to be able to relate to you. Just be kind. Even if you're not kind, I'm still going to be kind to you. But it's meeting people where they're at I always start with like, hey, let's talk about your meds. And I go through each one of their meds, as tedious as sometimes that might be, and be like, tell me why you're taking this, or why do you think that you're taking this? And even something simple as that. Or I'll be like, hey, your doctor has noted in here that you have kidney failure. Did you know that? Or did you know you have kidney disease? Oh, no, I didn't know that. And I'm like, okay, well, let me get a piece of paper and let's write down things that you need to discuss with your doctor when you go back in. Even something as simple as that, I feel like that really makes people, it builds rapport, it builds trust. And sometimes they find out stuff about themselves that they didn't even know, and I feel like that's terrible. But like I said, I love my job. I love what I do. And it's about educating. It's about advocating. I've called doctors from people's homes and be like, hold on, let me call them real quick, because why are you on 5 blood pressure meds, but your blood pressure is still high? Or why are you on, and I've called people's offices and left messages respectfully, obviously, like I don't want to step on no one's toes, but I'm like, hey, you might want to explain to Mr. Johnson why this, and this. Hey, I was by Mr. Johnson's house. Mr. Johnson didn't know that he had this. Maybe you need to go on a depth conversation. And I feel like that builds trust. And even talking to my other colleagues and stuff, I'm like, hey, just make sure you're explaining stuff to people. Even if you explain and they don't understand, or you think they're not understanding, just explain it. Even if you got to explain it every visit, explain it. If you know that Miss Smith is a talker and you see her name on that schedule, give her an extra 15 minutes. Make sure that you're addressing everything, because that's what I would want. That's what I expect. I go in with that. And for family members, that's literally how I go in. And it's respectfully, it's not about stepping on anyone's toes. A lot of people just don't know. So it's about educating and just putting that word out there. And like you said, and like Lecresha said, making sure you're telling people like, this is your health. This is your journey. What a lot of people do, and that I found in home health, a lot of people don't take the meds. So I'll go to people's houses and they'll have like 4 bottles of something. And I'm like, hey, why are you not taking that? Like, why do you have 4 bottles of it? Like, are you getting an access? And they'll say something like, oh no, like, I just don't like it. It gives me this side effect. Have you told your doctor? Well, no. Okay, well, let's have a conversation about that. There's just a lot of things like that, just about having a conversation, building rapport, building trust, and letting them know that, hey, I'm here on your side. So that's how I handle that.
All of that. But my approach usually in my world, in the OB-GYN world, as opposed to just general PCP stuff, when someone comes in, they usually have a problem or some sort of perceived problem, if they want the type of exams that I give. So therefore, I start with that, like, what brings you in? And I actually listen. That's the thing. And I don't think people really take time to do that. They just make the jump to the conclusion, and they could have a completely different concern, but you've only focused on the first thing that they said and went with that. So listening to in its entirety to their concern, what their perceived problem is, and having that conversation together. I'm going to tell you on the provider side how I would treat this, but I want to know your thoughts about this treatment, and I'm making sure that I give all the options while you're there, and making sure that you are aware of the options. Well, if there are any, so sometimes, there's only one way to treat certain things, but as far as with the medicine, but, so really and truly, I feel like in addition to what Whitney said, just making sure that patients are, and again, I know it's from a provider side, sometimes that schedule can be like, whew. And then, like Whitney said, sometimes you get the people that just love us dearly, and we love them back. But sometimes we just got to roll through certain things. But just making sure that you two have a basic meeting of the minds and an understanding of why they're truly here, or why they truly present, not just what you jump to the conclusion of, and then just treating based on assumptions and still not truly addressing the patient's concern. I find that so often, like, you still haven't gotten to the point of why they're here. They still have this concern. Like, you danced around it, you treated some things, but still not there. So making sure that all the concerns are addressed in entirety, or at least come up with a plan and express that plan to the patient in the event that that not everything can be done in one visit. So
Those are great things. And I think what I really took away from that, took away from what you both said was the main thing I think that all patients just want is to be listened, like to be listened to and to feel like they have somebody in their corner, right? That's going to bat for them. And if we're specifically talking about like the BIPOC community who, has not been treated very fairly, not just in general in the healthcare system, but in life in general. We talk about, what the effects that like racism has in general on Black, Indigenous, and people of color. Going to the doctor should not be one of those things, right? You should feel safe and validated and secure, and and going to providers like the both of you, like you're helping to address that issue of people not feeling safe when they go to the doctor, and having conversations and listening to them, and having like what to me are very simple like tools of just, let's not rush in this appointment. And I also, I understand the provider side of things too. I know that the medical system and the healthcare system is extremely overpopulated, and I think that the supply is just there's so much going on, and it's putting a strain on it. And so I think my next question goes back a little bit about what you both said about you being like one of the only, like you looked around and you're like, oh, okay, it's just us. It's just us here, the only like Black people in our graduating class, maybe not graduating class, but I think there's a real problem that is happening. And so what sort of things do you think needs to change, along with with your app being one of them, to like help bridge the gap in healthcare disparities? But what sort of things do you think in the medical system or the healthcare system need to also change to to help representation in the healthcare field?
I'll start with leadership for one. In our executive roles in our health system, there's rarely any Black or brown people. So when you don't see yourself represented, oftentimes it can sway you from that specific area. So I precepted a lot, honestly. If there was a Black or brown student who needed a preceptor, I mean, I never turned down a student ever. But to say the least, I think a lot of that has to change. A lot of it's like a buddy system where, they're not really promoting, even if they're qualified, some of the people that could do the work and change what the face of healthcare looks like. So I think getting more representation in those executive roles and leadership roles can be critical in the outcomes of the representation going down the pipeline, if that makes sense.
Where do I start? So to piggyback off what she says, a lot of times when you go into spaces, you're having people who don't look like the population trying to solve the population's problems. So if you don't understand the shared experience already, how are you going to solve my problem? That's first thing. So like she said, getting the leadership in. I feel like, and like I can definitely speak to our area. They're doing a lot of outreach to like high schools. Well, some programs are there to like reach high school students and trying to get them interested, Black and brown students interested into like the healthcare field, because sometimes if you don't see somebody like that, you just don't see yourself doing it. So they're trying to put people in there, trying to create like a realistic, like, hey, this is realistic. This could be you. Don't think that because you don't see a lot of people who look like you that you can't do it. So I think like having those high school programs, the middle school programs, addressing like certain healthcare careers, I think that's really huge. What else? Scholarships. Some people don't go to school because of scholarships. They don't have the money. They don't have the money, the time. Like you mentioned earlier about transportation. Some people don't go to college because of transportation. Just there's a number of things that I feel like we could do to address that, but those are just a few that I wanted to highlight.
Thank you. Thank you both. Is there anything else that both of you wanted to add? Any we didn't get to we didn't get to discuss today about healthcare disparities, culturally competent care, representation in the healthcare field? A question that I just thought of and just came to my mind is, what sort of advice would you give to people who maybe haven't been to the doctor in either a very long time or at all, to kind of help ease their anxieties about, going to that first appointment?
I always thank my patients for coming in because, like you said, it's not something that anyone really looks forward to doing, spending a part of their day being assessed or what have you. Granted, if they have a major issue, they may be relieved. But I mean, for the most part, no one really ever looks forward to going. So I always thank my patients when they came in. But trying to find, and I always encourage, basically like you're shopping, when you are looking for a provider, check their background, see what interests they have. A lot of times you can easily find out. Hey, the internet, you can find out a lot, and see if their values align with yours. But I would say don't delay it. The more that you put off preventative care, the more likely when you do actually go in, it could be fatal. So nevertheless, knowing is better than not knowing. Just because you don't know doesn't mean it doesn't apply to you. So it's better to get screened, better to ensure your health maintenance is in up to date. And just don't be afraid. Be more afraid of what you don't know rather than what you do know.
I always tell people to at least go in for your preventative cares. Go to your doctor once a year, get lab work. Go to the dentist. People skip the dentist. Please stop skipping the dentist twice a year because a lot of health issues come from your mouth. A lot of heart issues can come from your mouth. I guess bait advice I tell people is kind of like what Lecresha said, like it's better to know than not know. I know that it's a scary place and people, they'll come up and be like, well, I don't go to the doctor because of this. And it's always something. Sometimes I'm like, well, just pick another doctor. And sometimes people just need to hear that. I'm like, if you don't like what they're saying, just pick another doctor. It's really that simple. Like you just pick another doctor. If you felt like so-and-so didn't talk to you the right way, pick somebody else. Like she said, go shop around. Don't be afraid. And don't be afraid to ask questions. Don't be afraid to question your doctor, not in a nasty way or anything like that, but just respectfully, like, hey, like we talked about earlier, don't be afraid to ask questions. Because I feel like a lot of people don't go to the doctor because someone might say something that might offend them. And instead of, or they might not explain something. So then they just don't go. They just don't do it. Or instead of being like, hey, well, why do I need to do that? Sometimes people just need a nicer way or a different way of explaining things. And then they're like, oh, okay, I get that now. So then I'm like, yeah, so now you've not been going to the doctor for 27 years because of this, and I feel like I said, just don't be afraid to shop around. Don't be afraid to ask questions. And please go get your preventative screenings. At least start there.
And realize that there aren't any ridiculous questions. You didn't go to school to study this field.
Of course.
You're seeking advice, seeking care from someone who studied. So it doesn't matter how you present it or what have you. Just get it out there and get your questions answered. Like Whitney said, get your screenings done and just take care of yourself. You have one, as I always say, one lap around. That's it. So once that lap is done, that's it. So, just make it a point to prioritize that. And again, there isn't a ridiculous question out there for health providers. Trust me, 9 times out of 10 would probably have heard or seen it already.
And I always say that people be like, I know this is going to be really embarrassing. I've heard something way worse. That's fine. Like she said, don't be afraid to ask. And like she said, going back to one life to live, like sometimes when you see people in your family, you're like, oh, like my grandma had diabetes and she's going to dialysis. She doesn't have a leg. To me, I feel like that's all I need to know, that I need to go make some changes. But some people are not like that. So definitely think of your future in mind too, because you're not going to be young forever. You're not going to, and I think some people feel invincible too. They're like, oh, this is not going to happen to me. Yeah, it can, you know. I remember my grandmother she had dialysis, and I used to, when I had time, and I used to go sit with her and entertain her. Um, there was young people in there. There was like a lot of 40s, 50 young Black men who had high blood pressure, never went to go get it checked out, and now they're in kidney failure and on dialysis, all because you didn't go get something checked out. And I'm like, dang, you're giving up your life. And I don't know if anyone knows about dialysis, but that's like a real commitment that you have to have. And I'm like, all it could have took was you just, going seeing a doctor, making sure you're getting your screenings done, getting your blood work done, taking medication, and you would have more of that freedom, because like I said, dialysis takes up a lot of your life. So please don't hesitate. Find somebody that works for you. If they don't work for you, keep moving.
I think so many people that live with people in general, people who live with chronic illnesses, are not aware that if you have a bad interaction with a doctor, or say, a horrible experience that happened, that they can move it to somebody else. Like I know that wasn't like, I was just like, oh, I have to keep seeing this doctor who's like treating me like really, really poorly. And like that happened to me, an old neurologist. Like there were certain microaggressions that were like happening in the office, so, like when I would come in with my hair and it was like all big and for Botox, and she would make comments to me like, I don't know where I'm gonna find like your head underneath all that hair. And I remember sitting there like thinking like, I feel so uncomfortable right now, but I have to keep seeing her because this is my doctor. This is like who's taking care of my health. And I think it took me 2 years of like seeing her and dealing with like, microaggressions of her saying like, oh, you don't cry like my other patients when they get needles. And I'm like, oh, there's so much like going under the surface of like, Black people don't feel pain and all that other stuff that's like happening. And I think it took me like 2 years to be like, Sarah, like, time to find someone new, girl. Like, come on, let's go. Like, let's find someone new. Let's find someone that is empathetic and sees you. And I did. And it honestly made like literally like it's life changing. Like being able to like see a doctor that is empathetic, that listens to you, that hears you, that's not going to say microaggressions to me. And like the reason why it changed is because I'm seeing a Black woman, and I'm just able to be myself. I don't know how to explain it. And so I think like being able to see a doctor that shares, maybe even just a doctor of color, or someone who shares your same race or ethnicity, is going to help more people to go to the doctor. And that's why apps like yours out there are so important. So I'm going to turn it over to you guys. Is there anything you wanted to say or that we missed in this discussion that is important, that you feel like patients need to hear, or that, the healthcare system needs to hear?
We have a lot of work to do, and it takes companies like ours to initiate. But I mean, we need our partners, we need our community, we need support, and to do the work together. So that would be the main thing that I would just put out there. Just know that we are committed to this, but we definitely need the support to really be impactful, not just in Louisville, not just in Kentucky, or I mean, just nationwide, globally. Like, this is something that we are truly passionate about, and looking forward to the growth and changing what healthcare means. So that's all I got. What you got, Whitney?
What you said. And if anybody in government's listening, we need better insurance plans and better insurance coverage for people. Just throwing that out there. And affordable insurance, by the way. More programs that, like you said, are increasing minorities in the healthcare realm. That's very important. And just like what we've all been saying. Just let's be kind to people, whoever is out there listening. Be kind to your patients. Listen to your patients. Patients, drink your water, exercise, eat healthy.
Thank you. And thank you both so much. And if anyone, any of the attendees have any questions for Lecresha or Whitney, we'll take questions for the last few minutes of the panel. I realized that I didn't have the chat enabled, so apologies to all of you who were trying to type into me to tell me where you were zooming in from, and you were like, "Come on, Sarah, turn on the chat feature." So apologies about that. So I'm just going to read out one of the comments. Phenomenal webinar. I've been saying yes, yes, yes to the screen all hour. Thank you so much for your time, and hope this gets uploaded to YouTube. And yes, we will be uploading it to our YouTube channel, Chantel. While I'm waiting to see if other people chime in, I would be remiss to say that it is also Hispanic Heritage Month, and GHLF is having a whole array of things going on. So if you go to ghlf.org, there's a banner there, and you'll click on all the activities and videos and stuff that we have promoting Hispanic Heritage Month. So I hope that you will all go and check that out. And for all of you who aren't already part of the community, we recently created a community called Chronic Hue, which is a virtual community for melanated people living with chronic illnesses and disabilities. It's, I think, first of its kind. So if you're interested in being in community with other people like you, very similar to, it's the patient side of what health and with what melanated healthcare is doing. For those of you who are curious about melanated healthcare, Lecresha and Whitney, how can people find you?
So we have our app in the App Store and for Android users in Google Play, and we have our website. We are still actively working on expansion, so bear with us. I know this organization's out of New York, so a lot of our providers are more regional. But if you have a provider of color that you see, please encourage them to sign up so we can expand our reach. People are looking for them. Let them know that. So that is my ask of you. But yes, please visit our website, or download the app.
I just put the website in the chat right there for you all, because I know that there are people on this webinar that probably have doctors of color that would absolutely be signing up for this app if they knew about it. So for those of you all attending and that are going to watch the recorded the recorded YouTube, reach out to Melanated Healthcare, and reach out to your doctors to get them to sign up, because this is something that is so important. And I know, like, for me, I was like, okay, come to New York. We need more people. We need more people out there that are, seeing patients like us and helping our community. So with that, I just want to thank you all for attending. Thank you to Dr. Lecresha Sewell and Dr. Whitney Graves for a great, hour of talk, and for coming on Melanin Health Table Talk. So I hope everyone has a wonderful evening. Goodbye, everyone.